I'm Allie Pollack. I'm a pediatric endocrinologist, and I've worked in Wisconsin and in Washington, and developed this DiSH program, Diabetes and School Health, to really extend the care beyond the clinic where we see patients, a few times a year. And you as school nurses are seeing students every day, and you have a much better sense of the practical day-to-day care that they need and how that fits into their real life. So it's been really fun to develop and grow this program. So if you're new to DiSH, it's a monthly telehealth program that's based on the Project Echo model. So this is all via Zoom, even before COVID. And it's set up basically with a hub that has specialists of some chronic condition, medical condition, and then spokes, which traditionally were the PCPs. Hepatitis C in adults was the first condition this was used for. So empowering PCPs to really start care rather than wait for the subspecialist to have an appointment slot to see these patients. But we've extended it to diabetes because just a similar sort of model, patients, students sometimes have lots of questions or needs that only get addressed in clinic on visits or phone calls in between. So each session is a 10 to 15 minute, usually didactic sort of lecture on a topic that's really relevant to that condition, to diabetes. And then a lot of collaborative learning, both between school nurses and between the clinic staff and the experts. So sort of sharing our experiences. Oftentimes there's a case or a situation that's brought up that we discuss or multiple. And the goal is that we're all learning and we're all teaching each other. So I always like to emphasize it's not just a webinar. The first little bit will be a lot of information, but then after that, it's really hopefully dynamic conversation so we can all be engaged, learn from each other, and share experiences to do better care for patients with diabetes in clinic and in schools. And this sort of goes over what I just discussed, but a different way to see it. We have our presentation followed by our discussion, and then importantly, the survey afterwards to kind of keep learning how we can do this better. And we also put together an email that sort of summarizes both what was in the presentation, but what was also discussed after that, so that those who maybe weren't here or need some time to rethink things can get a summary together in the email. Please keep in mind, these DiSH presentations and discussions do not create or otherwise establish a provider-patient relationship between any clinician and any patient whose case is being presented or discussed in a DiSH setting. So when discussing any patient or student, please do omit any personal identifiers, name, birth date, etc., and consider whether you should withhold certain information about a student or school that can constitute information protected by HIPAA or FERPA.
All right. Thanks, Allie. Just as we were all hopping on here, I was chatting with our three presenters, and that this has been an exciting and fun presentation to put together. And one, as I've been chatting with various school health personnel over the last months, there's a lot of excitement, I think, about this topic, and a lot of questions that come up with this topic too. So for the sake of time, we will re-include the bios for these three fantastic presenters in the DiSH Highlights email. There's a ton of information about each one of them, but I don't want to spend minutes and minutes and minutes reading all of their incredible accolades and history. So with that, Catherine, I will kick it over to you and take it away.
Wonderful. Thanks, Kate. So today we're going to be talking about the Diabetes Medical Management Plan, and really kind of just going through the basics of what the Diabetes Medical Management Plan is, the purpose, the content, who's responsible for carrying out the Diabetes Medical Management Plan, and then really hoping to give you resources and education materials that would be important for you as a school nurse to implement for children with diabetes. You can go to the next slide. Okay, so the Diabetes Medical Management Plan is really the base or foundation that we develop all of the school-based care plans around. And a DMMP actually should be implemented for every single student with diabetes. This type of plan might go by different names in some school districts or by some healthcare providers, but essentially this is your healthcare provider order, and it really instructs you on how to treat all aspects of the student's diabetes. The DMMP is developed and assigned by both the student's personal healthcare team as well as the parent and guardian. So it's kind of a collaboration to really individualize this for the student. And it really should detail the elements of care and assistance for that student. Once the DMMP has been provided to the school, it's implemented collaboratively by the full school diabetes team. So this should include school nurse, the student themselves, parents, guardians, and other school personnel that may be taking care of that child during the school day. Details regarding how, when, and where, and by whom the elements of the DMMP will be implemented should be documented in writing. Many school districts have their own health forms where the school nurse documents information on the diabetes care. Additionally, both health and academic accommodations related to diabetes should be included in the broader education plan for students with disabilities. So, for example, there is the 504 plan. This falls under the federal law that states that students with diabetes are entitled to accommodations to ensure equal access to public education. So a 504 plan should be written to document diabetes-related accommodations needed by an individual student. Now, some students with diabetes may also be eligible for special education, and this would be an IEP, our individualized education plan. And for these students, it should be noted that there is a diabetes care plan available, and any diabetes concerns related to education should be addressed. Next slide, please. So the DMMP should include everything you need to know, all the necessary information that you'll need to care for the student with diabetes. So this includes emergency contact information for the family or guardian, the level that the child has in terms of ability of taking care of their diabetes. So you should have a really good understanding of what they are able to do. When and where to check blood sugars. Is it okay to do that anywhere in the school, or do you need to do that directly in the office? How to calculate the insulin doses and essentially the insulin, what's ordered by the physician, how to calculate that insulin dose, glucagon administration, meal schedule, managing sports, physical activity, PE, what to do when the glucose is above or below target. And typically you should get a new DMMP provided to you at the beginning of the school year. And if there are dosing changes during the year, you will receive an amendment that is given to the parents or faxed directly to the school. Next slide. Thanks. So the diabetes medical management plans, these specific ones were actually created for Montana back in 2018. It's a standardized form that can be used throughout the entire state. One form is specifically designed for students on insulin injections, and the other is for students on insulin pumps. You may see other forms that are similar to the standardized form. The American Diabetes Association has a really extensive form that they provide on their website that can be utilized. And I know, for example, Billings Clinic has created their own DMMP that they provide for their patients. But really, all of the forms should still contain the necessary information that you need to care for the individual student. Next slide. Now, in conjunction with the DMMP, there is this algorithm sheet. This is an optional sheet. It's not required, but it can be a really helpful form for anybody taking care of a student with diabetes, including other school personnel that aren't a school nurse. Essentially, what this flow chart provides is just a really easy to follow guide for managing the blood glucose results. Once the blood sugar glucose is checked, you simply follow the arrows to the glucose range. And it just gives you kind of step-by-step instructions for low glucose, in target glucose, and high glucose levels. You'll notice that once the glucose is high above 300, it actually separates it out, the instructions for both injections as well as pumps, since this actually requires a different management protocol. So I'm now going to go ahead and hand the presentation over to Marcy to talk a little bit more about some of the resources and education materials for you to actually use in your school.
Great. Thank you, Catherine. So I'm Marcy Butcher, and I'm a diabetes care and education specialist consultant to the state health department's diabetes program. Have been doing that for over 20 years, and I've been involved in diabetes care at school, kinds of resources and teams that look to develop resources for schools and school nurses. And I've been so excited and honored to be working with the school nurses across Montana. You do so much and you're so appreciated. And most recently, the group called the Montana Kids with Diabetes School Collaborative is the organization or the volunteer committee that sort of worked on these forms, and they are now available on the state school health website under the DPHHS website. And I just wanted to show where these were at, but the actual links are going to be at the end of the presentation. You'll have them in the handouts. They'll send them in all the resources that that Kate and the team at DiSH will send out to you, so you don't have to be scrambling to look for it. But just this, if you aren't aware of the school health program website, this is what it looks like. And you'll see towards the bottom right, there's long-term health conditions, and you'll be able to click on that and go down to the diabetes pages. So next slide, please. And so this is where the diabetes different toolkits are located. There's a parent and family toolkit. There's teachers and school staff toolkit. Next slide, please. There's a school nurse toolkit. And you can notice that there are the healthcare provider orders, or the DMMP orders are here for both pumps and injections. And there's some other resources there for you. And then the school nurse, Montana Association School Nurse link is there because you've got such an amazing amount of resources there over on your website. So we've tried to link those together. Next slide, please. And then also the healthcare provider toolkit is there that also has those in DMMP orders, and then also that algorithm that Catherine alluded to. And again, Catherine said that there are other DMMPs out there. These are just ones that were collaboratively developed by the Montana Kids with Diabetes School Collaborative. I know members of that committee. I saw several names of folks that were involved in developing those tools. So thank you, everyone. It also involved pulling together school administrators as well as school nurses, teachers, parents that had children with diabetes in the school system. And also we worked with the American Diabetes Association and the Montana Office of Public Instruction. So it was a huge collaborative effort to come together and work on all of those forms. Karen Graff is going to tell you later that those need some updating, and we'll be talking about that. But I also wanted to highlight some other resources that are on the school health website. Next page, please. So there are a couple of videos there, and I'm not going to show them to you today. Please take a look at them. This particular one is Diabetes Care in the Classroom that highlights a Montana kiddo from Missoula and his teacher, and they show sort of how they do diabetes care in the classroom and making that all work, and that, emphasizing that the kid is a kid first, but yet taking care and allowing for the safety and encouraging, optimal learning in the classroom. So that one's there, as well as a coach video. Don't keep them out of the game, because we hear a lot about coaches who are sort of scared to let those kids play or are worried about hypoglycemia. So there's a coach video available. that describes having a student athlete with type 1 diabetes and how to best help them be safe and yet be an active participant in their sport. It highlights Montana high school students who are student athletes as well as college level, which is kind of nice to give that sort of role model and mentoring for younger kids wanting to participate in sports. Lastly, next slide. We wanted to highlight the Diabetes Care in Your School OPI Learning Hub module. So this is the OPI Learning Hub is where Montana teachers often go to get their continuing education. And several years ago, this diabetes module was developed, and it offers 2 free credits for Montana teachers. And it's a pretty basic module, and it also needs some updating. So we'll talk about that. But these are available for teachers and any school staff, actually, to go in and learn a little bit more about what diabetes is and hyper and hypoglycemia and sort of how to respond to those things. So those are what I've got to talk about. And again, the links to all of these will be available to you later in the presentation and in the things that are sent out. And I'm going to hand it over to Karen Graff. Thank you.
Good afternoon, everyone. So here is a number of links on the screen here. There's also a scan. So if you want to take a picture with your phone, it'll take you to another PDF file that has more extensive resources. But I just wanted to give a little background along with what Marcy said about the development of those plans and those orders. Back in 2016, the Montana Association of School Nurses worked feverishly with the Board of Nursing to really clarify the delegation law. And there was a change in the delegation rule at that point. And if you want to see details about what that change was, what it meant to school nurses, the letters that went out to school administrators, also to school nurses, and a copy of the law, that's under the Montana Association of School Nurses. And if you go to the files under September of 2016, all of those resources are there. So if there's questions about those. I do just want to highlight a couple of things. The first one is the Montana Board of Nursing. There is a link at the top there. If you're concerned at all about liability, National Association of School Nurses recommends the NSO, Nursing Liability Insurance. Costs about $2 a week and $5 million coverage for that. So the link is there for that. Again, DPHHS has an extensive school health web page along with the toolkits being there. And then Marcy highlighted the OPI Learning Hub. That can be for teachers. It can be for coaches, anyone. I just went through it yesterday and it seems pretty user-friendly. And yes, it does need a couple of updates, but it's a good resource. And then I would be remiss if I didn't highlight a few things from NASN. We do have a clinical practice guideline and a toolkit, and those are listed below. Also, the NASN Learning Center has many CEUs and NCPDs that you're able to get credit for. And those are free to NASN members and a very reduced rate for non-members, but can provide you with school-specific diabetes education. Lastly, I just want to say that we're going to resurrect that Diabetes and School Health Coalition. And so we're looking for people to come on board with us. Many of the folks that started out with us in 2011 to 2018 have retired or moved on to other jobs. And so we're looking for those that are interested in being part of this. If you just want to put your name in the chat, we'll keep track of those. I know it took a lot of work in the beginning, and so I'm going to let you know that if those of you who worked in the beginning, we will not be spending as much time, but we'll just need to update them, and so it will be less time commitment than it was previously. And I'll turn it back over to Kate and Marcy if she has any comments about the coalition.
I can just speak to the coalition really quick. And thank you to Karen for bringing that up. And again, thank you to those of you that participated previously in that, including Karen. There was some great work that happened, but I think we're not starting from square one anymore. It is going to be leaps and bounds ahead of where we were starting out. And we would love to have your keen insight. If you've been using these forms, what are the things that are your pain points? Are there things that you can suggest to us for making everything, even better? So again, we know there are things that need to be updated, and boy, we'd love to have your assistance in making the next group of resources really fantastic. Thank you.